how they approach the patients, what questions they ask, what is the goal, what is the problem of the patient. And then you round again with your charge. So we started this on the one piece. So first, it was the charge nurse coming through. So like the actual nurse has no responsibility to know about the patient, right? But that's not true. All together, we have to understand. Everybody has to understand what the problem is. So then gradually you get closer to the patient. It has not only patient trust you about you on top of things and you understand the problem, but also it creates that connection with the patient. They feel comfortable. They come to that safety zone of trust. And we talk about daily around with the physician, hourly around with the patient. It's not like about you putting a timer and then go every hour to the patient's room. That's ridiculous. It's just be present. Just go in and out to the room and find out what's going on with the patient if they need anything. And the daily round with the family is so important. We have to volunteer to talk to them. We don't want wait till everything bad happened and then they called us to find out what's going on. We have to volunteer to go to the room when they go into the room to see the patients, to ask them if they need anything, to share with them the problems and help them to understand. And sometimes they don't even understand what we say because they are so involved and confused with the problems, and you try your best to be so use simple terms, but still they don't understand. But it doesn't matter as long as they feel that you care. They feel the trust. They're not doctors. They don't know exactly what we do isn't even correct. But they trust. Phone calls, follow-up phone calls is so important. We gotta call the following the people who go home. That's so powerful. The patient that goes home and you call them up, you told them everything on the discharge plan and everything. And when you call them the following day, they don't remember anything. You told them 10 times to take a shower, for example, they don't remember. Right? So the follow-up phone calls is so important. I did that in my practice and it was so powerful. It was so powerful. It took me 5 minutes to call all of my patients that I did surgery before to connect with them. The fact that I called them, it made a significant change. Even when I talk right now about it, I feel that human experience of gratitude, and that makes me happy. And it will happen to you, and it will happen to us if you do that. So we have to have that practice of someone, a charge nurse or nurse, responsible to make phone calls for our patients that are going home the following day to find out if they need it, if they have questions. Okay? And it takes 5 minutes to do that. And then creating the connection. Okay, we are human. We have so many tools to create connections. Sometimes we don't even understand it. It's about the eye connection, the facial movement, or a smile, the way our standing, our posture. You need to be present in the room. You don't need to sit in the room for 2 hours and ask them questions about their life story. That's not the meaning of connection. The meaning of connection is when you go there for 1 minute, to be there. To be there with them. To be present. To listen to what they say. And care about what they're saying. So many things I said to the residents the other day. So many things you learn about patients' problem just listening to what their complaint is. So that shared experiences happen when you can connect with the patients with just listening. Even voice, the tone of voice, make a huge difference. So we go into the room as a nurse or anyone, as a doctor, and we are busy. And we show arrogance instead of showing compassion and kindness. And that 2 minutes of relationship doesn't mean anything. It's about really smiling and really being there and being present. And you have to do that practice. Some people better than the others as far as connecting, right? But it's all here. You don't need to read a book. Just try to be a good human being. With your smile. The smile is so important. I don't want you to have a fake smile and walk around in the hospital, because that doesn't mean anything. It has to be authentic. But it will be authentic if you care. If you really care. And you care if you understand the value of what you do. See, these are all connected together. Okay? And then we talk about quicker response to the patient need. Okay, yeah, they buzz and then you're tired and you have to give other things to the patients. Of course they get upset. Because 1 minute for them is like a 1 year. You don't understand because you were not patient. But if you're a patient, you understand that 1 minute means 2 hours. Half an hour means days. It's so hard as a patient that is in pain and needs to go to the bathroom or restroom to wait. I don't tell you to wait and leave everything behind and get into the room. Just pick up the phone and say, I will be there as soon as I finish. Just respond to them. Just tell them that you're there, you care. And they will calm down. They will calm down. They feel comfortable and they feel safe. And a lot of problems that happens in the hospital that people are unsatisfied and unhappy is because we don't respond to them right. So we say, they don't understand us, we're so busy, I have to do this computer, I have to give that medication, but put yourself in their shoes. They don't understand these things. It doesn't matter if you tell them or not. And they're right. They're right. You put yourself in their shoes, they're right. So all you need to do, and that's what the friendship and teamwork means. The other nurse pick up and go into the room quickly and respond. If they need a blanket, it doesn't take that long. I can go get the blanket, and I've done it so many times. It doesn't matter. I don't need to say, I'm going to ask the nurse to come and give you a blanket or the water or ice, right? And that's all you need to do. Education. We need to educate the patients. I told you several times. People sometimes they don't even understand a lot of these words. We try so hard. I try so hard, draw pictures and stuff like that. They still confused at the end of the day. It doesn't matter. You do your job. Try to explain to them, educating them, and it's so important. Again, it creates that connection, that feeling of safety and trust, and then empowering the patients because the hospital again is not a hotel. It's not Disneyland. It's not, we have to pamper them. They are part of the team. They have to participate in their care. They need to get up and move and take a deep breath and all this stuff. They have to participate. So that's part of our education, is telling the patient that they are responsible. They have to understand that if they want to get better, they gotta work. They gotta work hard. They gotta work hard. So empowering them is so important. These are not just the things that is like a slogan or big names or big words. These are real things. We have to. We can't treat them, give them pain medication to go to sleep because they have a little pain, and all day don't participate in physical therapy, and they don't get up. They don't get better, we know that. Right? And then we need to treat them with dignity and respect. You see, when you understand the value of humanity, the value of compassion and kindness, then all these biases in our mind, these beliefs that are being taught to us from childhood about color, about sexualities, about race and nationalities, in medicine, we have the privilege of letting them go. Because they're all human. It doesn't matter if they're black or white or they have accents like me or they have different sexual preference. They're all human. So you have to treat them with dignity and respect. And that's the most important thing when you go and visit them in the room. And the pain medication is so important. It's so narrow field. You don't want to treat them, again, pamper them because they ask pain medication. They have to get educated that the pain is okay. Sometimes having pain is okay. They have to participate in their work. A warning, sometimes I go in there and patient comes, I can't even wake up the patient, right? Because they got pain medication. So the whole day they're laying down in the bed. I don't care about the discharge instruction and having the decrease in the day of the stay in the hospital and all of those crap, right? All I care is that my patient needs to walk around and participate in physical therapy. I want my patient to be part of my team because my goal is to get them better, to bring them back to society. I don't want them to sit here all day and take pain medication. So that's a very critical thing that we have to understand. And it's all about being accountable, right? Again, these are big words. But being accountable means